I know you wrote a paper recently calling out how there are all these clinical trials for cancer treatments that so grossly underrepresent Black people.
So this is actually an op-ed that I wrote. We have like a large cancer meeting that occurs every year. So the original research results were presented at that meeting, and it's for like a really efficacious drug, so a drug that works really well. But then as the presenter was rounding up their presentations, they were like, and one of the limitations is that we enrolled 0.6% Black women. And for me, I just felt triggered, right? Because I'm a Black woman. I've had a diagnosis of pre-invasive breast cancer. I know women who are Black women who are my friends. These are people I know with breast cancer. And so when I saw that 0.6% Black women for a breast cancer trial, I just felt tricky because it's like, this is outrageous. There is no way that in 2026 we should be enrolling 0.6% Black patients in a breast cancer trial. And then as I looked further, I realized there were more men enrolled than Black women. And we consider breast cancer a rare cancer in men, right? It's not that it doesn't happen, it does happen, but it's considered rare. And so more men, Black women, I thought was just scientifically egregious. It was like unethical as well, right? Because we're moving towards precision medicine, which hopefully will help us see a patient in the clinic and to be able to tailor therapies to their exact biology and predict how they are going to react to the drug in terms of toxicity. But if you have a trial that is predominantly enrolling women who are not Black, then you have this translation into clinical practice where you're treating patients who are Black women with a drug that wasn't really tested in them. And so, is it truly representative? I think we can do better. There have been trials that have enrolled more women, but I think if we are going to have a drug that's FDA approved, we need to enroll populations that are representative of who gets breast cancer. Like if you ask who gets breast cancer, like Black women have worse mortality from breast cancer compared to white women. And so it was just something I couldn't let go. I thought, other people would talk about it or there'll be a commentary about the publication, but I didn't see anything. And so I wrote an op-ed about it. And I didn't want to write another journal article that would be buried. I wanted to write a lay article that anyone could read and see that Black women are underrepresented. And I'm hoping that it generates sort of renewed dialogue and interest about it. I think industry sponsors, researchers should do better in terms of putting systems in place to ensure that we can have a more representative enrollment in our clinical trials.